Welcome back into WDHN at Daytime. Now, a very special interview regarding some new equipment at Southeast Health and how it diagnoses lung cancer. Now, I'm here with Dr. Walter Doty to talk more about it. Thank you for joining us today.
Thank you so much for having me, Ashley.
Absolutely. And can you just really explain, what this new equipment is all about?
So one of the most common problems that we deal with as a pulmonologist or a lung doctor are lung nodules or spots on the lung, as people would often refer them to. And the question is that something dangerous, or is that something that we could probably just watch? And so we've done a lot more watchful waiting in the past. But more recently, more newer technology has become available to try to help us to explore the lung, particularly further out in the lung, in the periphery of the lung. And that is what the ion robotic bronchoscope allows us to do. It starts off by making a 3D reconstruction of the patient's chest, including the airways, and it uses that as a road map, almost like GPS, trying to drive a small catheter out into the lung. And this is driven by a large robotic arm that is very stable and very firm and can hold any given position. And that allows us to really stare right at a nodule of interest and provide, biopsy instruments in order to sample these lesions.
And now, how can you say this is, when it comes to improvement, how much is this improved compared to maybe traditional ways of diagnosing lung cancer? So
a great question. So historically, we've really had two ways to biopsy the lung. I kind of tell patients it's from the inside out or the outside in. The outside in way is with numbing up a spot on the outside of the chest and with CAT scan guidance going in with a needle through the outside of the chest. That works. The problem is that the lung is just a large bag of air, and when you stick that with a needle, the lung can sometimes collapse. And that can happen in a significant number of cases. The other way that traditionally we've done this is with a bronchoscope that is handheld. I literally hold it in my hands and drive it into the airways, but the problem is that it can't get very far out. It's also not a very stable platform, so it's really, I'm controlling it with my hand, so it's only as stable as I am. And so this is a huge improvement. It allows us to access nodules that are further out in the lung, and then also be more stable to kind of bring more instruments to bear on those nodules.
Now, can this, maybe change ways or improve ways on how patients will receive care, especially in the wiregrass?
I certainly think so. I think the biggest improvement that we'll see is that traditionally, if I wanted someone to have this procedure, I was having to send them to a large academic center. I was having to send them to a Birmingham, an Atlanta, a Gainesville. And now this is a procedure that's available right here in the wiregrass, and you can be here with your family and your support system. And this is an outpatient procedure where you come and you have it done, and then you go home afterward, and the next day you really have no restrictions and no pain or anything like that. And so I think that is a huge upgrade compared to the way that we've done it previously.
And just one more question here. How has it really been going so far for you guys?
It's actually been going great. We have been accessing parts of the lung that we would have never tried to access with a standard bronchoscope. And it's we've kind of had to recalibrate our thinking a little bit about exactly what's possible. We've had a ton of support from Southeast Health and respiratory therapists and anesthesia as far as kind of bringing this program and kind of getting a thoracic oncology program off the ground. And we're obviously really excited about where this could go in the future.
Well, Dr. Walter Doty, thank you so much for coming on Daytime to really talk more about this with us.
Well, thank you so much for having me.
Yeah, absolutely.